Hey guys, it's Kyle, the founder of Dental Office Managers Community, and today we are here with Tonya Burns. How you doing today?
I am fantastic. How's everybody out there?
Doing well, doing well. Yeah. So, I brought you on our webinar here, and I wanted to introduce you to the community. You're kind of already really involved in the community, and I've seen that you're like super helpful. I've
I
seen your
love I
comments.
love your community.
And we love you because you're an expert on all things pedo, and that's kind of why I brought you on here today. Really wanted to just kind of pick your brain a little bit, but just share a little bit more about yourself.
Okay, I'd be happy to.
So just let us know. Your expertise is in pedo, right?
Yeah.
Okay. So just share with me a little bit more information on it.
So I started in dentistry over 25 years ago. I was going to be a teacher, and Columbine happened, and I was like, no way, not doing this. So I know, like everybody, that's such a major point. But I wanted to do something where I could help people, and I kind of fell into dentistry. So I started as a dental assistant. Ended up like just I wanted more knowledge. I wanted to understand more. So then I started learning about insurance in the front desk and met a consultant in a practice, and she taught me all the systems of the front desk, and then she promoted me to office manager, and I was pretty young at that point in time, but it was like, wow, here's something I can do. And it was just easy for me. I felt like it came naturally, and I had this just love for it. So I actually ended up going to work for her company, continued to train. And then I was also working for a pediatric dental office. And who knew I could again find something that I loved so much, because pediatric dentistry, it's so pure because there isn't cosmetic dentistry. You're not selling these big cases. You are essentially changing these little human beings who don't know any better. And more so, you're helping their parents because they have this fear of the dentist themselves. So fast forward a few years, quite a few years. I ended up working in pediatric dentistry for 12 years, grew practice very large. I was helping practices on the side at the time. And I decided to go full time and work on my own. So I really just pride myself of being able to go in and make sense of all of it, because it happens. It's so fast, the volume, the repetition of what you're doing. And if you can't have speed and efficiency, it's a very difficult world. And I help try to break that down and make it so it's an easier work day where we don't all feel burnout at the end of the day. And because there's a lot of turnover in pedo, it is not for everybody. I can tell you that. So all you pedo people out there, hats off to you, because it's hard. It's hard in a different capacity than other parts of dentistry are hard.
Is that one of the challenges, the high turnover in pedo
It is,
that you're seeing?
yeah, especially since COVID, it's hard to find employees. Everybody's facing that in dentistry still. It seems to be getting a little bit better, but it's a different skill set. As a pediatric assistant, you're not making temporaries. You're not, depending upon your state, the expanded functions. A lot of times it is just, behavior management, and, pediatric dentistry isn't like the olden days. They don't papoose everybody to get work done. There's more sedation dentistry involved. And how, now you've just told a mom that their child has all these cavities, and now we're going to put them to sleep too. And that's a lot of pressure on people as they're coming in. And sadly, the training can be not the best experience because we just don't have the luxury of having people in dentistry as a whole, but especially pediatric dentistry, that are just there to train you on what to do. So I try to fill that space.
Gotcha. Thanks for sharing that. You mentioned sedation in pediatric dentistry. So they're not still tying kids down with like, straps and stuff.
Now, I won't tell you it never happens. I probably in my 12 years, I saw the papoose used maybe 10 times. And most of the time it was with autistic children or other special needs children, because the hug of the papoose board actually comforts them. Only one time can I remember that we had to do it as a safety issue. There was no time to be able to sedate the child. She had fallen, had trauma to her forefront teeth, and they had to come out. So I won't tell you that it never happens, but it's not like, when we were kids and, you're just going to get in there and they're going to power through it.
Yeah.
You're going to get it done.
Power
And your
through
mom
it.
told you you're getting it done. Now we're working on the side of, you better get this done, but my child better not cry. They better not be afraid, so you're working in this whole other realm that, you're working with the psychology of the child, but also the psychology of the parent. It's very interesting.
So is that what they called it? Papoose board?
Papoose board,
Papoose
yeah.
board.
And it literally
I never knew
has
that.
these straps that they Velcro you in, and your arms are down, and it feels like a hug. So
Sounds like a straight jacket. Sounds like a straight
almost
jacket.
like a straight jacket.
Sounds like a straight
but
jacket.
they're literally like on a backboard. And it straps their head in place so they can't move their head. So it's very archaic in some capacity. Now, I won't tell you that nobody's still using it. We have dentists with varying ages, experience, and what they believe to be true, but I rarely see it anymore. More apt to put a child to sleep to treat them because they won't remember anything. And then it's like, oh, I woke up and I feel better. So.
Okay. So thanks for explaining the papoose board. Let me ask you, I've seen in the group a lot of questions about pediatric dentistry. I know we definitely have some office managers in there that are working in pediatric dentistry. Um, I think one of the recent questions I saw was, it had to do with like dental associates, like bringing on a new dentist. And I think there's some challenges there that I've been noticing. It's kind of trendy at this point, if you want to call it that. But maybe share a little bit of your expertise with us on, bringing in a new associate into the practice. Like, what are some things, we can use to help better ourselves?
That's a great question. The biggest thing that I see is lacking giving themselves time. It's like all of a sudden the office manager finds out another dentist is coming in. We've got to get them credentialed. What do we do? From a legality standpoint, they have to bill under their own NPI number. They can't bill underneath the owner dentist unless that dentist is in direct supervision at all times for them, and they're the ones signing the notes off with the associate dentist. So it's kind of counterproductive. So my suggestion with practices that I work with is we start working 6 months in advance. So if we know somebody is coming in, knowing that transition, we're already ghost scheduling hygiene patients for them. Ghost scheduling, meaning I'm creating a column that I know is going to go to them because my doctor can't handle to work this many columns. Maybe we'll do max of 3 columns of hygiene for a provider, which is a lot if you think about it. In general dentistry, 3 is a stretch. Now double that because we see kids every 30 minutes. Wow. So you go schedule. So they walk into a schedule of hygiene patients. So instantly they have the ability to diagnose treatment. And then closer to them coming in, start giving your patients the option of, well, here's how far we're booking out for the doctor. We do have an associate coming in, and you really talk up this associate. Doctor handpicked them. They've waited for them, which are all true statements. We've been working on this for 6 months. And so then you can start to build their restorative side of the schedule as well. And in that 6 month time period, it gives you time to get them credentialed with all the insurance companies you're in network with. So they walk in, you make sure you schedule them a little bit lighter than how you schedule the existing doctor, because especially if they're straight out of residency, it's going to be a little bit different. If you take Medicaid, that typically is a higher volume, and sometimes that can be a little bit of a time management issue. And they also have to have time to like get their spiel down. You know, the spiel from residency is a little different than the spiel in private practice. So, but all these things build you time for them. And you can have conversations on what they want. So you can prepare your team on how are they going to be the same as your doctor, but how are they going to be different? Because we can't expect a carbon copy. You know, they're going to treat people a little bit differently. They may diagnose a little bit differently and treatment plan a little differently. And then you've also got to work on, depending upon where you're doing sedation at, if you're not doing oral sedation or IV in your office and you need hospital privileges, well, those take time to get as well and to try to get on a hospital schedule. So there's several factors involved, and time is never on our side. So that is my biggest tip to the community. If you can give yourself 6 months, you can set up a really great situation where your associate isn't just doing hygiene visits when they start, and they'll be productive from day one.
Wow. Okay. So let me ask you a question. I appreciate the response. That was a really good information there. Um, I, I'm actually kind of dealing with a situation where, we're starting to bring an associate dentist into the practice, and you really hit a point or a soft spot, right, so to speak, where you said, we can't make a carbon copy. And I feel like, I wish we could.
Oh, yeah, me too.
I wish we could, because it would make, I think, our lives a lot easier, but also I feel like the success level would probably still be the same and there wouldn't be a lot of challenges up the road.
Mhm.
So what would you, if you could give a number one tip or advice of how we can kind of merge the two doctors together, right?
Mhm.
What would you say?
So and I think that this is absolutely the biggest problem, and there are more transition breakups in because of this than anything. But I think you have to ultimately hire somebody to come in your practice that fits the way that you work philosophically. You know, you can't be a dentist that is conservative in nature and then bring in an associate who's aggressive or wants to save the world. And let's face it, all associates want to save the world, especially when they just come out of school or residency, because they've got this fire that they have gone to school for 8 to 10 years for. And now this is what they want to do. And they have these ideals, and they'll come out of the gate blazing, and all the patients in your practice are going to reject them if it doesn't match the same style. So that is my number one tip, is that really encourage your doctors to look at people who fit the way that they practice. And then it's really easy to support them as they come in, and tell your patients, let them know we have somebody coming, and start putting that into the conversation, especially if you're scheduling far out. Oh, I know it's far out now, we may be a month out, but guess what? We have the most amazing associate. Doctor handpicked this person to come in because they treat patients so similarly to the way that they do. Really hype that up and give them that confidence in who's walking in the door, and they'll feel like they know them, and that's going to help you have a much, much easier transition.
Hmm. Yeah. Yeah, that's one of my biggest fears, I would say, is, you get a really aggressive associate in there. And, the practice I work with,
Oh,
the doctor's conservative, and it's very much like, you know, we don't want to throw the book at the patient, right? We
No.
really want to get the patient in, give them a nice feel for dentistry, so they can really get established and say, okay, I feel comfortable here. That's the way
Mhm.
we've done things, and I feel like it has worked, it has helped. Um, but, like you said, a new associate straight out of school has this fire and desire to, take on the world, and it's great, right? I mean, it's a good
Yeah.
thing. It's it's not a bad
Just may
thing. I
not.
mean, but
Nope.
I don't think you want someone who's ready to just, treatment plan A, B, C, D, A through Z, you know? Um, but that's one of the things that probably is a I'd say fear of mine, and it's also difficult finding associates. Is that
Yeah.
something
Well, and
that
especially in perio,
yeah, 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 in terms
the
of like,
specialists are hard.
yeah, yeah, we're noticing, we're learning, we're seeing ourselves firsthand,
And we're in the north. Nobody wants to come to the north where it remotely gets cold.
yeah, yeah,
They
yeah,
all
yeah.
want to go south. Hey, those southern states are getting saturated. Come up and see us. We're close to airports. You can fly out to the south. That's what I feel like telling everybody.
Yeah, it might work. I don't know. So, Tanya, in terms of insurance and pediatric dentistry accepting insurance plans, are they having like similar challenges? Like, are there certain insurances they may want to be in network with versus like out of network? Like, how does that typically work in pedo?
So, most pediatric dentists that I have encountered are in pediatric dentistry because they want to help kids, which means open themselves up to a lot of insurances. Some want less than others, and I'm in support of whatever they believe in. My philosophy on it is if you're familiar with the NDAS fee survey, they come out with it every year. It's by zip code. It'll tell you, well, any specialist really deserves to be in the 90th, 95th percentile just because they're a specialist. Because that fee survey isn't built, they don't have a specialist section. It's just, it is what it is. And then when you take all the technology and the advancements and everything else, they deserve to be above the 95th percentile off the charts. The problem is the insurance companies aren't there. And since back in 2008, when everything crashed, we were building in the early 2000s, we were building that non-participating fee-for-service mentality. The economy crashes, the insurance companies were like, yes, we're going to get them all back. And now they've brainwashed everybody again into, I have to go where my insurance tells me to go. So if you can learn the proper skills, I am in no way saying you should lie to people. I just go around the question when they ask me if I'm in network with an insurance, if I'm with a practice that's not heavily involved, because they've chosen to set their fees less.
Yeah.
So I might encourage them to set their fees around the 70th percentile. Now, that's a big hit, 70 to 95. However, insurance companies have UCR fee schedules in addition to their PPO fee schedules, which are significantly higher. So if you can set your fees in a manner that it feels to your patients like they're in network, especially as you're building. Once you're established, it's so much easier to get out because they know you, they love you, different things
Yeah.
are possible. This is at the beginning. And if you set those fees lower, the insurance companies are typically going to give you 100% of those fees,
Hmm.
or very close to,
Right.
where it doesn't seem like you're out of network. So as long as they can go anywhere they want to go, then it helps the practice to have more money coming in, less write-offs, and you don't have to sign up with everybody out there. I'm also a fan of networks over insurance companies because the fee schedules are higher. But yes, you are opening the door to all the network leasing that's out there, and now you're involved with all of them. But remember, you're only contracted with one. So if you choose to get out of it, the lease agreements are gone too.
Mm,
So it's really understanding your plans, it's understanding your fees, how much you're writing off. And so I like numbers. So I enjoy that game
yeah.
of where can I put you. So I have a startup pediatric practice in Wisconsin. They've been open for 3 months now. They're doing fantastic, and they're network with 4 insurance companies. Them is
Mm,
Medicaid, because we set their fees lower, and we're seeing very, very little in terms of fees being over. The allowable is on the UCR schedules, so they're actually getting paid better than if they were in network with everybody.
wow. Okay. So you mentioned, thanks for sharing that, but you mentioned, which caught my attention, and it was a phone call about in-network versus out-of-network.
Oh yeah,
Okay, let's do this. Would you mind doing this where we can actually kind of play a role
sure,
role play this real quick? All
yeah,
right, so I'm gonna be the caller, and
okay.
then you're gonna, be the office manager or, dentist, whoever's answering on the other line.
Not
Um,
your dentist, never your dentist.
I know, right? I just want to throw that out there. It should never be a dentist. I agree with you 100%.
Sorry to all the
But
dentists.
yeah. Unfortunately, they're not in our community. All
There
right,
should be a
so
safe space for us, right?
exactly, yeah. So, all right, let's do this. So, I'm gonna call, and I'm gonna start out the phone call with you. So, all right,
Okay.
I'm gonna do a really good, try to do my best with this impersonation, but all right, ready? So, phone call rings.
Mhm. Thank you for calling Pediatric Dental Office. This is Tonya. How may I help you?
Hi, my name is Kyle, and I'm looking for a dentist that takes my insurance.
Hi, Kyle. I'm going to tell you what, you have called the right office. We have exceptional dentists here. What questions do you have about your insurance? What do you have?
Well, I was told that I should see a dentist that takes my insurance, and I really just want to know if you guys take it.
Oh, I'm sure the insurance company told you that because they love to pigeonhole you into a certain office to go to. Well, Kyle, here's what I love to tell everybody who calls. We work with all dental insurances. We can file for you. We will accept
Hmm.
the assignment of benefits, and we are able to estimate what your portion will be quite closely, if not exactly, to that. That way, we can make sure we're minimizing any out of pockets for you and you're not paying anything additional than what you would need to.
Okay. So you're in network with my insurance?
It's not exactly in network, but it's the participation level we are with them. So we'll have the ability to file those claims. They're going to give us all the information about your plan. And then we'll be able to estimate it just like any other office that you would go to out there and make sure that you're maximizing that without additional out of pockets.
Ah, okay. Okay. So if I come to the office, do I have to pay?
Well, it depends on your level of benefits. What we do here is we're going to send you out a packet of paperwork. You're going to get that electronically. You're going to fill that out for us. And that is going to be a demographic for your dental insurance. We'll get that information. We'll call, we'll get your benefits. And as long as you don't have a copay on that first visit, no, you will not have to pay anything to come into the office. If there is a portion that's due, we will let you know that up front so that you're prepared.
Wow, that sounds amazing. That is awesome. I love it.
Love to have you, Kyle. We take great care of our patients here.
Yeah, it sounds like it. It sounds like you guys are sharing more with me than the other office I called 2 seconds ago.
Yeah. Well, we're a little bit different than everybody around here, and we pride ourselves on that. Our focus is you.
What makes you guys unique?
Well, I think that it's our level of patient care that we have. I can't speak to the other offices in the area. I'm sure they are fantastic as they have been here for years. But in our office, the patient is our priority. and we bring you in and we want you to have the experience that we all want to have within the dental practice. And financially, that's a huge part of it. So we don't want there to be anything hidden from you. We don't want there to be any surprises. We give you the best level of information we can based on the information your insurance shares with us.
I love it. I love it. I love it. And I'm so glad that you had a conversation with me because the last office I called just told me that they don't take my insurance and they hung up on me. Can you believe that?
Well, you know what? Hey, it's great. You found us, you called us, you're here now, and you're going to love it.
Thank you so much. Let's get something scheduled.
Sounds great. You,
Okay.
that's the biggest thing though that I hear with people. Somebody calls and says, "Are you in network with MetLife?" No, we're
Yeah.
not. I mean, and it's like you just lost a major opportunity for
Yeah.
those patients. If you're marketing and you're paying for marketing, that's
Yeah.
like crying tears of $100 bills or something going down your face. So, don't be afraid if you're not in network with people. Make them feel good before they ever walk in the door. We're that first line of defense, right? We can make or break the practice before they ever see our doctor and our clinical team.
Yeah.
So don't be afraid in there. And I've got a few things for the group I've been working on because I get a lot of questions about my
Ooh.
behavior-based bonus system. So I'm writing an example so I can put it up so people can put it together step by
Oh,
step.
cool. Cool.
And I have some verbiage I can share too. It's getting comfortable.
Yeah.
And I've said the same thing for 20 years. So it takes practice to work
Yeah.
with people, but give them a level of care you'd want to have, and you'll have a much, much easier result.
Yeah. I agree with you 100%. And Tanya, I appreciate you taking the time out today to really share your knowledge that you've learned over the years and just freely giving it to us so that we can, just better ourselves and ultimately help our practice.
Yeah. I believe that that's what we need. I believe in this change that's in dentistry. There's a huge community of people out there who want to be part of that change, and that is helping to educate everybody because you don't know what you don't know. And these groups are fantastic because we can openly give information or help if we see like wrong or accidental illegal information being given out, because we see that from time to time, to help and guide somebody so that they're not in a bad situation.
Yeah. Yeah, I agree. I agree, Tanya. So thanks again for coming on. And, for any group members that would like to get in touch with you, I know you have a website. Just share with us a little bit more. If anyone would like to reach out to you to maybe, just learn about your consulting services and things like that, how could members reach you?
Yeah, so I'm going through a little bit of a rebrand right now. So the website is not up. It will be soon, but it's elitedentalcoaches.com. We do have a Facebook page, Elite Dental Coaches. And then, of course, you could always message me through the group. I'm happy to
Okay.
help anything. And if it's something, one thing I really appreciate about you, Kyle, is if something's out there and you're like, share it for the group. If it's something that it's going to be pertinent to the whole group, I'm happy to put it out there. The only time that I ever have spoken behind the scenes is if I'm asking questions about numbers that maybe you don't want to give. But we can find ways around that too, because I want it to be open for the community. I feel like we can all learn from each other.
Cool. Yeah. Yeah. I love it. I love it. So, okay. I before we go, I do have one little surprise with you that, that I've been doing with other members who are doing webinars for the group.
Yeah.
And we have a question. So the way it's going to work is, I'm going to give you the question, and then in private, you're going to share with me a question for the next guest.
Oh, okay. This
How do
is
you feel?
exciting. I
How do you
love
feel
this.
about it? Okay. All
I
right, good.
love this.
Okay, all right. So all right. So the question I have from our last guest, um, this is the question. What is the most expensive mistake you have ever made? And
Ooh,
could you share that with us?
Yes. Okay. So the most expensive mistake I've ever made, I I had a potential for a client in Colorado, and I saw so many possibilities in their practice. And I just went out there and was totally me and, all these things, but I didn't listen to what it was he was actually asking me for.
Mm.
And therefore I lost the client. And, you know, was it a learning lesson? Yeah, absolutely. But that's what it was. I wasn't listening to what he wanted. I just kept telling him what I could do. And he's telling me this isn't what I want, but I did it anyway. And ultimately I lost the client for it. So listen to your patients when they call too. I mean, it's the same thing. Listen. We listen to respond. We don't listen to hear. And it's a skill I'm still working on.
All right. Yeah. Yeah. Same here.
I think we all should.
Yeah, exactly. All right. So Tonya, thanks again so much for coming on and giving us a little bit of your time. I know you're very busy. And, we're going to get that question for our next guest from you in private.
Okay.
But I look forward to doing more of these in the future with you.
Yes, me as well. I love this community. Thank you so much for accepting me into it and letting me be a part of it and just do a webinar with you. This is absolutely like dream stuff for me. So thank you. I appreciate it.
Oh, thank you. Thank you. Thank you, Tonya. All right. Take care and we'll talk soon.
Okay. Have a great day, everybody.